Hello, professionals. This is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. As we are discussing about, the topic which we are talking about is endocrine system, and in previous video we talk about, or you can say we can include it, bone mineral homeostasis. So now we are going to talk about the last deviation or clinical condition, that is diabetes mellitus, and this happens basically the deviation of insulin level. So we will talk about its point and relevant detail. So without wasting more time, let's start our topic. As long as the introduction is concerned, as you know that diabetes is a elevated blood glucose level. It happens due to either the absence or inadequate presence of insulin. We majorly have three major types of diabetes. Number one is type 1, number second is the type 2 diabetes, and third is the gestational diabetes, which often happen or appears in pregnancy situation. So as long as the symptom is concerned, a diabetic patient will face polyphagia, polydipsia, polyuria, and weight loss will be prominent in a diabetic patient. So our point number two is about the tyrosine and lipase increase during pancreatic disease. Whenever there is a pancreatic deviation, two enzyme, that is the tyrosine and lipase, its level will increase. Point number three is about the tolbutamine. Tolbutamine is a first generation sulfonamide. Its dose is 500 mg before each meal, and maximum dose is 3000 mg, but it has a problem with that increase the risk of cardiovascular diseases. It's a first generation sulfonamide. It's the example of first generation sulfonamide, and similarly there are other examples, that is the chloropropamide and chloropropamide and tolazamide and acetohexamide. These are also the examples of sulfonamide first generation. As long as the tolazamide is concerned, tolazamide is more slowly absorbed than that of all other first generation sulfonamide drugs. Point number four is about the sliding scale. It is a method. It is a method of determination of insulin dosing based on the blood glucose and ketone in urine. We will decide in our prescribing of insulin or intervention on the basis of blood glucose and ketone in the urine. This is defined as or termed as the sliding scale, and its functioning of number of pulses in this way. In its regular insulin dosage is prescribed by physician because of a sliding scale according to the data of ketone as well as blood glucose level. That's why it is defined as the sliding scale method. Point number five is about the point number five is about the parameter of glucose tolerance. We have three parameters for glucose tolerance. Number one is the peak concentration of glucose in blood. Second is the time required for peak concentration, and number third parameter is the rate at which glucose declines with time. So these three parameters are required for the glucose tolerance. Point number six is about the regular insulin, or you can say crystalline zinc insulin, whose its an hypoglycemic effect appear within 30 minutes. I will just give you the specification of this insulin. That is not regular insulin, or also known as crystalline zinc insulin. Its hypoglycemic effect appear within 30 minutes. Its route of administration is subcutaneous, and its peak onset of action appears, or its peak level achieved within 2 hours, and duration of action is 5 to 7 hours. Its dosage form is available in the form of a vial or disposable pen. As long as its IV infusion is concerned of regular insulin, it is particularly prescribed for the diabetic ketoacidosis patient and during preoperative management of insulin requiring diabetes. A person who require insulin is going in the process of operation for that patient, and especially in the treatment of diabetic ketoacidosis, we prescribe IV infusion of regular insulin. As you know that commercially 1 ml syringe is equivalent to 100 unit, and it's commercially available for the management or for the administration of insulin. So this was all about our point number 6, and point number 7 is about diabetic ketoacidosis. So the question is why it does happen. There are several reasons for it. Number one is the type 1 diabetes, or you can say type 1 diabetes and type are infrequently in type 2. It happens more in type 1 diabetes and infrequently in type 2 diabetes due to sepsis, pancreatitis, or high dose of steroidal therapy, or failure of patient to utilize the insulin, or lack of insulin, or omission of doses. These are the reasons. Because of that, our blood ketone level of our blood increase, and it makes it acidic. That's why it's known as diabetic ketoacidosis. We use following dosage regime for its management. That is the zero point 0.1 unit per kg per hour is a starting dose for the management of diabetic ketoacidosis. And as I told you that we use regular insulin through IV infusion, one of its condition other than the preoperative condition for management of diabetic ketoacidosis. Point number 8 is about the test tape. As you know that this test tape measure glucose in blood and urine, and doesn't give false positive in patient who is taking cefotoxin. Sometimes the use of cefotoxin gives false result, but test tapes measure glucose in blood, and it doesn't give false negative in the present if a patient, even if patient is taking cefotoxin. Point number 9 is about the test for the presence of glucose, which how we would determine if glucose is present. In this way, we will use reagent strip, which is impregnated with the glucose oxide peroxidase orthotoluidine. Once this impregnated strip is dipped into the urine or blood, this glucose oxidizes to gluconic acid and H2O2 and peroxidase and orthotoluidine. It appears in the form of blue color. That's why we, in this way, with this chemical reaction, test for the presence of glucose is carried out. Simple is that reagent strip that is impregnated with this chemical, that I would like to repeat it once again, that is the glucose oxidase, peroxidase, and orthotoluidine. So this strip is dipped into the blood and urine for the detection of insulin, and it appears in the form of blue color. So this was all about point number 10, 9, that is the presence of insulin test. Point number 10 is about the symptom of hypoglycemia. The most prominent symptom of hypoglycemia is tachycardia, sweating, nervousness, irritability, and confusion. Point number 11 is about the drugs, that is this sulfonamide, its mode of action, and we'll give you example and doses of almost or oral anti-hyperglycemic drugs. So first of all, there is a sulfonamide that binds to high affinity beta cell sulfonylurea receptor at pancreas and stimulate insulin secretion. It's as I already told you about in previous point about the first generation sulfonamide, its example, but second generation sulfonamide is mostly available in pharmaceutical preparation form, and it is widely used. So let's discuss its examples. First example is the glyburide. Its starting dose is 2.5 mg or less, and average maintenance dose is 5 to 10 mg per day, and it should be taken single morning dose. This is all about first example, that is the glyburide. Second example is the glipizide. 30 it is taken 30 minutes before breakfast. Its starting dose is 5 mg per day, and up to 15 mg per day can be taken as a single dose. Third example is the glimepiride. It's also taken as a single dose 1 mg, and maximum dose shouldn't be more than 8 mg per day. Fourth example is the gliclazide. Its starting dose is 40 to 80 mg per daily, and maximum dose can be 320 mg daily. Next, this was all about the examples of sulfonylurea. Second is the biguanoids. One of its most famous example is metformin. I'm sure you are very well acquainted of it. So just for a revision, I would like to let you know its dosage regime. Metformin tablet maximum daily dose is 2.55 gram. 500 mg OD-BD will with meal, or you can say you can also use 1000 mg BD daily or 2 times per day daily, or in third case we can also use 850 mg 3 times per day. The main thing is that it shouldn't be go beyond 2.55 gram per day. Next is the thiazolidine Its example is the pioglitazone. Its starting dose is or its dose range is 15 to 30 mg per day, and maximum dose could be 45 mg per day. Next example from thiazolidine is the rosiglitazone. Its dose is from 2 to 8 mg per day, and this the duration the dose should be those should be within this 2 to 8 mg per day of rosiglitazone. It shouldn't be long. It shouldn't be crossed from above 8 mg per day. Next, point number 14 is about the alpha glucosidase inhibitor. Its example is the acarbose. Its starting dose is 50 mg 2 times per day to 100 mg 3 times per day. And next example in alpha glucosidase inhibitor is the miglitol. Its dose is 25 mg 3 times per day to 50 mg 3 times per day. Point number 15 is about the GLP-1 receptor agonist. Its dose its example is the exenatide, and its route of administration is subcutaneous, and its starting dose for first month is 5 mcg, and if tolerated then you can increase its dose 10 mg twice daily. It should be administered 60 minutes before breakfast. Then this was all about exenatide, that is the example of GLP-1 receptor agonist. Next example of GLP-1 receptor agonist is the liraglutide. Its dose is 0.6 mg and 0.6 mg, and you can increase after 1 week to 1.2 mg daily. So starting dose is 0.6 mg, and after 1 week its dose can be increased. You can double its dose like 1.2 mg daily. So it was all about liraglutide, that is the example of GLP-1 receptor agonist. And next is about the next example of this GLP-1 receptor agonist is GLP-1 receptor agonist is the LB-glutide. Its starting dose is 30 mg weekly, or you can say its dose is 30 mg weekly. Route of administration is subcutaneous injection. And next example is the dulaglutide. It's also used subcutaneous route for administration, and its starting dose is 0.75 mg weekly, and its dose can be increased from 0.75 mg to 1.5 mg weekly, and route would be same, that is a subcutaneous injection. Point number 16 is about the DPP-4 inhibitors. This is the most famous drug. It's available in the form of tablets. So its example is the sitagliptin. Its dose is 100 mg once daily. Next is the soxagliptin. Its dose is 2.5 to 5 mg daily. And next example is the linagliptin. Its dose is 5 mg daily. And next example is the alogliptin. Its dose is 25 mg once daily. And the last example is the vildagliptin. Its dose is 50 mg once daily or 2 times per day. Once daily or 2 times per day, or BD. This was all about DPP-4 inhibitor. Point number 17 is about the GLT2 inhibitor. It's a sodium glucose cotransporter inhibitors. So it's also in short known as SGLT2 inhibitor. Its example is the canagliflozin, and its dose is the 100 mg daily, and its dose can be increased to 300 mg in once. But one thing must be need to kept in mind, that once you are going to increase the dose of this canagliflozin from 100 mg to 300 mg, renal functioning should be normal. Otherwise, don't increase its dose and just stay it till 100 mg. So this was all about canagliflozin. Next example is the dapagliflozin. Its starting dose is the 10 mg, or you can say its dose is 10 mg once daily. But if there is an hepatic impairment, then its dose should be reduced, and it should be, and for the hepatic impairment patient case, its dose should be 5 mg. But for normal patient, its dose should be 10 mg once daily. This is all about dapagliflozin. And last example from SGLT2 inhibitor is the empagliflozin, and its starting dose is 10 mg daily, and it can also be increased from 10 mg to 25 mg daily. So this was all about SGLT2 inhibitor. Point number 18 is about the other drugs which is used for hyperglycemia or diabetes. That is the prem, pramlintide. Pramlintide. This is a drug which is also used uh, parental route for administration. It's for type 1 patient. Its dose is 50 to 15 to 60 mcg per day, and for type 2 patient its dose is 60 to 120 mcg per day, and it is administered immediately before eating. This was all about the prema prem prema lean tight prema sorry for pronunciation wrong, pronunciation issue. Premlin Premlintide. This is all about this Premlintide. Second example is the other from the other is the coliciviram or cholesterol. It is also effective for management of hyperglycemia. Similarly, bromocriptine has also role in management of diabetes. So this was all about drugs which is used for the management of diabetes. The other section that is very important and very functional and practically majority of its drugs are available, that is the insulin. So let's talk about the various classes of insulin and their doses, and then we will move on our next points. As you know, insulin is divided in two major types. That is the short-acting insulin and long-acting insulin. As long as short-acting insulin is concerned, first example is the regular insulin. Its onset of action is 30 to 60 minutes and duration of action is 6 to 8 hours. Its other examples are Lispro, insulin aspart, glulicine. These all have the onset of action from 5 to 10 minutes because they are short acting, and duration of action is 3 to 4 hours. So this was the example and other specification for the short acting insulin. I would like to mention it once again. That is the regular insulin, Lispro insulin, aspart insulin, and glulicine insulin. These are the example of short acting insulin. Second is the long acting insulin. And the first example is the NPH, and its onset of action is 2 to 4 hour and duration of action is 10 to 20 hours. Similarly, glargine, its onset of action is zero point 0.5 to 1 hour, but duration of action is 24 hour. Similarly, Detmir and insulin Detmir, it's exactly insulin Detmir. It can be pronunciated as Detimir or Detmir. I think you get my point. That's the main thing. Its starting dose is zero point 0.5 to 1 mg. Its onset of action is zero point 0.5 to 1 hour, and its duration of action is 17 hour. Similarly, insulin degludec, its onset of action is zero point 0.5 to 1.5 hour, and its duration of action is more than 42 hours. Similarly, there are third type is that pre-mixed insulin. That's example are 70-30. It's the NPH. You will mix with the regular insulin. You can say long acting insulin is mixed with the regular short acting insulin, that is known as 70-30 mixture. Next is the NPL, that is also known as neutral protamine lispro. Neutral protamine lispro is combined with the NPL is available in two pharma mixture, that is the 75 to 25 or 50 to 50. And next is the aspart is combined with the NPA. Its mixture is also 70-30, and degludec is combined with the aspart. Its mixture is 70-30. 70-30 mixtures are available in formulation, or you can say pharmaceutical preparation form. So one thing keep in your mind from all the example of this insulin, that pre-mixed insulin should be prescribed 15 minutes before or after starting a meal. This is the guideline for its administration. Protamine zinc insulin longest duration action is 36 hours. Protamine zinc insulin's longest duration of action is 36 hours. So this was all about our points and their drugs which we use for controlling any type of either type 1, type 2, or any type of deviation with the reference to this diabetes and deviation of insulin. So these any deviation relevant to blood glucose level will only be controlled by the implication of these examples which I've already mentioned you, and doses has also been explained here. So next is the point number 21, that is about the insulin purity. It's a point that how we would classify the purity of insulin. So insulin purity is intravenously post-operatively, or you can say post-operational to, you can say, proinsulin. Proinsulin example as the 86AA is an insulin impurity. It is used for comparing of insulin impurity of various insulin products. If we want to compare the insulin purity with the various insulin products, then one of its example is the proinsulin 86AA. It's an insulin impurity, so we'll compare them to check the level of our purity of our insulin. This is all about inverse so that's all about the insulin purity, so just keep in your mind. Point number 22 is about another example of biguanoids. It's also just like metformin, it's known as the phenopharmine, and it's phenopharmine, and as you know that uh, biguanoids class is specifically recommended in case when due you can say when hyperglycemia is due to ineffective insulin action. It mostly happen in obese person due to insulin resistance, and biguanides class is chosen for it. An example that is the most effective in that case is phenopharmine side by side the metformin. When insulin resistance are present, or insulin isn't going to perform its action, or due to ineffectiveness of insulin. So this was point number 22 about the phenopharmine. Point number 23 is about again the first generation, that is tolbutamide, and diet. It is used for the management of diabetes mellitus. So just it was just a reminder of from the first generation sulfonamide class. Point number 24 is about the pancreatitis. Pancreatitis is a characteristic, or you can say pancreatitis is an inflammation of pancreas. So, is a characteristic by increasing the, or you can say pancreatitis is characterized by increasing the level of amylase. It's an enzyme which causes the helps in the digestion of carbohydrate. So when its level increases, it also indicates the pancreatitis. Point number 25 is about the normal insulin secretion is 50 units per day. This is just for information that normal insulin secretion is in our body is 50 units per day. Point number 26 is about the level, how we would identify the normal pre-diabetic and diabetic level. We will tell you in two units. One is the milligram per deciliter, and second is the millimole per liter, so that you can tackle any question relevant to each unit. So, for a normal person, in case of fasting, insulin level as you can say fasting in fasting stage, insulin level of normal person is below 100 milliliter mg per deciliter. So now I will tell you everything. Our reading will be told in a milligram per deciliter. So uh, in a fasting stage, normal person's glycemic level should be less than 100, and in fed state, or you can say after 2 hours of fed stage, it shouldn't be beyond, it should be less than 140. Similarly, if the same person is pre-diabetic, then in fasting stage its level should be between 100 to 125, and if after in the fed stage its level shouldn't you can say its level would be above 140, as in normal case after in a fed stage patient's level in blood glucose level should be less than 140, but in a pre-diabetic stage its level should be above 140. Similarly, once diabetes is established, then in a fasting stage, blood glucose level increases, that is, goes beyond, you can say, equivalent to 126 mg per deciliter or go beyond. Similarly, in a fed stage, blood glucose level increases from 200. So, this was all about the insulin. and its dosage. We can also determine through HbA1c level. As you know that in a normal stage, normal insulin is 5.7. When the reading of HbA1c is 5.7, it indicates the normal insulin level. Similarly, when the reading is when a person is pre-diabetic, then its insulin level is 5.7 to 6.4. And similarly, when a person increases, when this person is diabetic, then its HbA1c level will increase from 6.5. So this is all about the reference of HbA1c about the reading. So as long as you will monitor this value relevant to the millimole per liter, then I will quickly just give you a review. In a fasting stage, once a normal person, insulin blood glucose level will be 5.6 millimole per liter. In a pre-diabetic stage, its level is 5.6 to 6.9, and in a diabetic stage, in a fasting situation, its blood glucose level is above 7 or above 7. Similarly, in fat stage, normal person's blood glucose level is 7.8 millimole per liter, and in a pre-diabetic stage, its level is 7.8 to 11, and in a fast, as you can say, once diabetic stage is established, then its level in a fat state is 11.1. That's all about the main thing. So either you can also define the form of milligram per deciliter, that is mostly used, but in some time it can also be asked in case of millimole per liter. So though both readings should be kept in your mind. So this was all about the point number 26. Point number 27 is about the regular, as you can say. I think so video is going too long, so I want to conclude my detail here. In the next video, we will resume from here and conclude our topic. Thank you so much for listening, and if you feel that our this effort is helpful for you, then please subscribe us. Your subscription